Madam Chair, Excellencies, distinguished delegates. I have so many nice words saved for you, but I'm going to say it at the closing ceremony. We have come to the end of the rather intense, engaging, some occasionally exciting, high-level segment. We have a ministerial declaration, and my experience is that the declaration adopted with the greatest controversy are declarations which are remembered longest. So, hearty congratulations to all of you. What has struck me most throughout this session is the breadth of engagement and the wide array of issues discussed here. This session is being held at a time when good news is scarce and the news of suffering and adversity are abundant. Yet we have come together and delivered a constructive and productive session. Let me take this moment to highlight some of the main messages of this high-level segment of ECOSOC. First, maternal mortality received the prominence it deserved at this session. Maternal mortality and its causes that include poverty, lack of basic health care, prenatal and postnatal care, lack of education, lack of information on sexual health and reproductive and other basic rights that hamper women's empowerment were brought to the forefront. We are fully aware that the poor maternal health has many ramifications for the health of the newborn and unborn child. Poor health of the mother is reflected in her children and therefore has important consequences for future generations. It is therefore absolutely critical to take strong, urgent action. Second, if we were to resolve our concerns in health, we must begin with the primary health care and sound health systems. Developing countries currently face serious barriers to developing strong health systems. They are mainly lack of financial capital as well as human capital. While delivering on the promises of aid is imperative, equally critical is the availability of skilled health workers. At present, many developing countries face an exodus of skilled health workers to developed countries, resulting in a burden on their already strained resources. Third, the emerging challenges in health were also discussed in depth. Globalization has meant that diseases do not respect borders, rank, or class. The H1N1 pandemic has now joined the food, fuel, climate change, and financial crisis, adding to our list of challenges. At the same time, developing countries brought to our attention the non-communicable diseases and injuries that were taking a toll on their populations. Moreover, previously neglected tropical diseases remain a scourge. Fourth, message from high-level policy dialogue with the international financial and trade institutions on the current developments in the world economy were sobering. They were cautious in their comments on the pace of economic recovery and its expected time frame. Recovery will be long and arduous, especially in terms of increased employment, which ultimately has an important role in alleviating poverty and improving consumer demand. All expressed concern that developing countries will bear the brunt of the crisis. Needless to say that negative impacts of the current developments in the world economy will be exacerbated in the case of the least developed countries, LDCs, landlocked countries, LLDCs, and small island developing countries, CIS. Fifth, on a more positive note, I would like to congratulate all those countries that made national presentation at this year's annual ministerial review. The high quality of presentations brought to light each country's unique circumstances and perspectives, as well as their accomplishments and the challenges in a clear and succinct manner. These presentations, I'm positive, will be valuable, first, to the Member States, second, to ECOSOC's work in the future. Sixth, the broad participation and engagement from all our partners was very encouraging. It sends a message of solidarity and a recognition of the fact that finding solutions to common challenges need global involvement to resolve. Finally, I would like to congratulate ECOSOC on the adoption of a comprehensive and action-oriented ministerial declaration. ECOSOC, despite constraints, through dialogue and participation, is helping countries in advancing their development priorities, and it has also given the issues of health a new platform. I would like to take this opportunity to thank all the UN agencies, particularly the WHO, for their tireless support to the work of ECOSOC. Madam President, distinguished delegates, next year we will hold the DCF, Development Cooperation Forum, in New York, which will see how much progress is being made in aid effectiveness. We shall also review the implementation of this year's declaration. This will be the proof of how far we have moved from promises to implementation. For me, this is the true test of the success of our work. As far as DESA, Department of Economic and Social Affairs, is concerned, we promise our unwavering support to you. Thank you, Madam Chair.